and welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving health and well-being in the city of Chicago. Community Pulse is presented by the Foxglove Alliance, a public health coalition supported by the Hectone Institute of Medicine and Hectone's Nurses and the Humanities in partnership with the Healthcare Council of Chicago, which is an initiative managed by Third Horizon Strategies. My name is Megan Phillip, and I am one of Community Pulse's rotating hosts from the Healthcare Council of Chicago. Today, our guest is Mariana Thomas, who serves as the Black Organizing Program Manager with Planned Parenthood of Illinois. So welcome, Mariana.
Thank you so much, Megan. Thank you for having me. Yes.
Yeah, it's great to have you. So for our viewers out there, it's probably not March anymore, but today for us, we are on the tail end of it and celebrating Women's History Month. So Mariana comes to us from Planned Parenthood, which is at the forefront of supporting and elevating women, especially as it comes to their reproductive health care. So Mariana, tell me a little bit more, and I know that many of us are familiar with Planned Parenthood, but let's just, for the record, put it on the table. What is Planned Parenthood of Illinois' mission?
Absolutely. So once again, thank you again, Megan, for this opportunity. Thank you for having me. Again, my name is Mariana Thomas. I am the program manager for the Black Organizing Program at Planned Parenthood Illinois and Illinois Action. So Planned Parenthood of Illinois is Illinois' most trusted provider of reproductive health care. We are also the most respected leader in educating everyone in Illinois about sexual and reproductive health care. We deliver age-appropriate, comprehensive, and medically accurate information that empowers people to make informed choices about their reproductive health care and family planning needs and choices. And of course, we have our advocacy arm, which is Planned Parenthood Illinois Action, that advocates at the state level for the reproductive health care rights and needs of everyone in Illinois. And that is where the Black Organizing Program, my program, that's like our niche.
That's really great. We're going to come back to the advocacy and the organizing that you're doing in just a few minutes. But let's just take I think often we think of Planned Parenthood as abortion services only. But as you just mentioned, there is a plethora of other services that you provide. So please tell us more about what people can access at Planned Parenthood in Illinois.
Absolutely. So first of all, Planned Parenthood of Illinois, or PPIL as we call it, we serve more than 60,000 patients a year. That's a lot of people, right? And we do that because we have multiple health centers around the state. So we have 11 here in the Chicagoland area and 6 throughout the rest of the state. And of course, as you mentioned, we do have our abortion services, but we also do breast and cervical cancer screenings. We also do comprehensive birth control services, emergency contraception. We do HIV and STI and STD testing. We also have PrEP and PEP prevention for HIV. We do gender affirming hormonal care. We do HPV vaccines, vasectomies. I mean, these are just a number of things that we do. And of course, we also provide all of this care through our telehealth services, our app, PP Direct, and of course, having people come in for in-person appointments. So that's a little bit about what we do at Planned Parenthood of Illinois.
That's wonderful. And let's talk a little bit more about the Planned Parenthood of Illinois' Black Organizing Program that you manage. As many may know or not know, a lot of the challenges that come with reproductive health often come unfortunately with the color of our skin. A lot of access issues in Chicago are related to where people live and also other factors. So would love to know about the advocacy and the work that you're doing to support Black women specifically through your work at Planned Parenthood.
Absolutely. So, as I mentioned, the Black Organizing Program is under the advocacy arm of Planned Parenthood. And what that means is that I spend my days working with the community, working in the community, and letting folks know, letting Black people know in the community what we're doing at the state level to protect their reproductive healthcare rights, but also learning what the reproductive healthcare needs are of the community. And so I also host small community conversations called Shop Chats that are hosted by Black-owned businesses throughout the Chicagoland area. And we have conversations about mental health and wellness in the Black community, gun violence, which is a public health crisis that Planned Parenthood is very much concerned about and advocating for gun violence prevention. We are also doing, in preparation for Black Maternal Health Week, we are hosting a screening of Birthing Justice, a documentary about the Black maternal health crisis in this country and what we can do about it. We're hosting that screening April 11th at the Gene Siskel Film Center, which is located at 164 North State Street. Again, it's April 11th at 6 p.m., so please come out and hang with me there. But that's just a little bit about what we're doing with the Black Organizing Program.
That's really great. I think it's super important to think about listening to our community, and it sounds like you have a lot of great opportunities and programs, and as you mentioned earlier, a lot of people can access some of these resources through the app and through the website, and going to your local Planned Parenthood to find resources and find people like Mariana that can educate you and learn more about what your needs are. I want to take a broader kind of view on some of the things that we're looking at when people tune into the news these days. There are big issues like violence, and the other big topic, especially as we think about it from the federal perspective politically, is abortion access. So since the federal decision around Dobbs to overturn Roe v. Wade, what has that implication been here in Illinois? Some of us may know that Illinois does still offer many services and opportunities to access abortion, and we are quote unquote a safe state. But what has that really looked like in PPIL of Planned Parenthood of Illinois' work, and how does that trickle down here in how we're interfacing with communities?
Absolutely. So, I want to reiterate what you just said, which is that we are a safe haven state, and abortion is safe and legal in Illinois, and as long as we remain vigilant about that, it will remain safe and legal in Illinois. So that is something that we do not take lightly, and we are always doing our advocacy work in order to ensure that Illinois remains a safe haven state. And so what that also looks like is that we have seen our out-of-state patients numbers increase dramatically since the Dobbs decision. And so we have seen over patients who have come from over 35 different states to Illinois to access this vital and essential health care, which is staggering numbers. It's always staggering to me when I hear that. But also it is also just reminds me that these are the fortunate patients. Like, these are the patients who are able to access childcare, who are able to find transportation, who are able to take off work. And there are so many other people who are not able to do that and are not able to make that journey. But we at Planned Parenthood are dedicated to anyone who is trying to access this vital and essential health care. So we have our Abortion Navigators program, where it is their job to help anyone who needs abortion access to find childcare, to cover travel costs, sometimes even cover the cost of the procedure, just so that they can access this often time-sensitive health care that many people are going without in this country. So we are doing everything we can to keep Illinois a safe haven state and keep abortion legal and safe in Illinois. But it is really devastating what has happened to this country since Dobbs.
Yeah, absolutely. And I feel like it's amazing to see how you all have stepped up, especially on behalf of people that don't live in the state of Illinois. You know, a lot of this was in the works and coming down the pike, and I believe that your organization has been following this and was readying themselves. So what does that look like, and what does it mean for Illinoisans? You know, I mean, we want to open our doors and be as welcoming as possible, but, you know, are there dramatic wait times, and are people still challenged now because of that influx, or how have you all prepared and readied yourself for this moment?
This is a great question. I've got this question quite a few times. And the answer is like, we were preparing for this moment way before Dobbs happened. So there are not higher wait times for our Illinois patients, right? Because once again, this is a time-sensitive, essential, vital health care. So we have done a lot to make sure that any patient, whether they're from Illinois or out of state, is able to access abortion care as quickly as possible, as efficiently as possible. And some of the infrastructure that we have put in place over the last few years to allow that to happen is that we have opened new health centers near Wisconsin and Indiana. And we have expanded abortion services at our Champaign Health Center in Central Illinois. We have also expanded our abortion navigation program, which I just mentioned, and how they, you know, help people to get here and navigate abortion care. And we've also expanded our telehealth services so that we can mail the abortion pill to our Illinois patients. And we also have a partnership with Planned Parenthood Wisconsin so that their doctors and clinicians can come to our Waukegan Health Center and service their patients here and our patients as well. So we've done a lot, and we've been preparing for this moment and just trying to make sure that we have the infrastructure and the people and the clinicians so that our patients, whether they're from Illinois or out of state, are not waiting longer than usual, because that can have really devastating consequences. So
that's great to hear. So I think that's incredible that you all have been very centered in making sure that we're able to provide for patients, especially with that time sensitivity. Let's go back to what you mentioned with the film screening and some of the things that are coming up for Black Maternal Health Week. Tell us more about some of the ways that Planned Parenthood of Illinois and Planned Parenthood in general are taking action to really support Black maternal health.
Yeah, so of course, Black maternal health is a very, you know, it's a personal thing for me. These statistics around the fact that Black women are 3 times more likely to experience pregnancy-related cause of death than white women. And there are a number of reasons for this, from implicit bias, systemic racism, underlying chronic conditions, just a variety of disparities already in place that make pregnancy a really difficult time for Black birthing people. But what Planned Parenthood has done is we have a Bridges to Prenatal Care program, which is an initiative to literally bridge the gap for our Planned Parenthood patients, to help them to see their OBGYNs or midwives or doula services or any prenatal healthcare provider, so that they can access the care that they need as they are going through their pregnancy journey. And I would be remiss to not include in what Planned Parenthood has done is under our kind of advocacy wing. In 2021, we supported the Illinois Legislative Black Caucus's omnibus bill, which is basically a whole bunch of bills and legislation that was to address systemic racism in the medical practices in Illinois. And so what that looks like is one of the bills, for example, expanded access to doula services and home visits for birthing people. And so that means that Black birthing people have access to those things to help them to navigate pregnancy, but also one of the bills also included requiring healthcare professionals to take implicit bias trainings to try to get them to be better whenever they are engaging with Black birthing people, because this is important. This is a personal issue for me. These statistics are staggering, and something needs to be done about it. And so I really commend the work that we have done to not only acknowledge this crisis, but also to do something about it. And of course, again, I have to plug the film that we are showing, Birthing Justice, on April 11th, that is all about this Black maternal health crisis in the United States, and what we can do about it.
Yeah, and I want to say that there's, beyond the film, there are so many articles and resources to better understand this issue of this crisis that we are really having as a country. And it's just tremendous that you are doing this work on the ground, really listening to communities and patients and thinking about what their needs are. And I think it's great that we have taken such a fast-acting approach to advocacy, and that you all are thinking of it through policies that can support this. Tell me a little bit more about current legislative efforts. You know, the omnibus bill was a little bit a year or two ago, and a lot of those things are still coming into place. But, you know, as we solidify some of those great wins, what additional opportunities are we seeking out through Planned Parenthood of Illinois' legislative agenda, especially during this current session?
Absolutely, and we're always doing something.
Always something to be changing.
Something. Yeah. So this legislative session, we are focusing on a couple of things. The first is we want to increase funding for there's the Title X program, which is a program that allows for lower income patients to have access to reproductive health care. Mm-hmm. That federal program is vastly underfunded. And so what that means is, even though Planned Parenthood of Illinois has been approved to receive that funding, because it's underfunded, we haven't received those funds. So we're asking the Illinois General Assembly to fill that gap so that we can make sure that any and everyone, no matter your income status, is able to access this important care. The other thing that we are doing, which also has to do with budgets and money, is that we want the Illinois General Assembly to fund the bill that they passed last session around providing comprehensive, medically accurate, age-appropriate sexual health education to students. So we want to be able to have school districts get the funding they need to create curriculum that is according to the standards that was passed with that act and bill. So we want them to fund that because our students, our youth need that, and that keeps them safe and healthy, and so that is important legislation. And this week, we are trying to get past a bill that would stop deceptive practices of crisis pregnancy centers, and that bill is Senate Bill 1909. So if you want to call your state senator and tell them to pass that bill, please do, because that is also important legislation, what we're working on even today, right now in Springfield.
Yeah, I think that's all important stuff. You know, it comes from how we look at the makeup of our providers, ensuring that, you know, with these misguided communications, sometimes you want to make sure you're going to a trusted source. Encourage you to visit Planned Parenthood of Illinois' website. And earlier she mentioned there's an app, which is news to me as well. So I think it's always good to continue to look for those resources, ask questions, be diligent about where you're going and what you're doing. I think these are the things that will continue to make sure that we protect ourselves and our communities and our family members from any harm, and making sure that we're accessing the things that are available to us. So, you know, how can, in addition to attending the film on April 11th or looking for the film elsewhere, if you missed that, and seeking out other information, what else can we do today? What can I do and all of our viewers out there do to get involved in Planned Parenthood and supporting all of these advocacy efforts?
Absolutely. Well, first of all, there's always something to do.
Yes.
So you can volunteer with Planned Parenthood. You can volunteer with Planned Parenthood in Chicago or in Illinois or even around the country. So we're always looking for volunteers. We love our volunteers. You can also donate to Planned Parenthood. You can donate also to the Chicago Abortion Fund or the Midwest Access Coalition. And these funds work with our abortion navigators to help mitigate costs for people who are seeking abortion care in Illinois. So you can always donate to those organizations. You can also share your abortion story. I mean, now more than ever, we need folks to share their stories. So you can go to our website, ppil.org, and click on the Share Your Story button, and you will be able to get instructions as to how you can do that. You can also join the Black Organizing Program and hang out with me and do some really cool volunteer things. Like this summer, I'm going to be out and about in the community at various festivals because who doesn't love Summertime Shy? And so I will be tabling and recruiting volunteers. So if you want to come hang out with me and see me, you can go to our website, which is www.ppiaction.org. And while you're there, you can learn more about the film screening on April 11th, but you can also learn about our upcoming Lobby Day on May 3rd, which we're really excited about. It's our first in-person Lobby Day since the beginning of the pandemic. So come down to Springfield with us, be a Springfield superhero, and come and lobby your legislator and let them know why reproductive health care is important and why they need to pass legislation to protect reproductive health care rights in Illinois. So that is just the beginning of what you can do.
That sounds great. I think there's a lot of opportunities to give, to volunteer, to advocate. So these are all wonderful. We're going to wrap up here in just a few minutes, but do you have anything else you want to share with folks today?
Just that I love this work. I love that we're doing this during Women's History Month, right? And just to know that this is vital and important work, and never to take for granted the fact that we're in Illinois and abortion is safe and legal here, but we have to remain vigilant. And so these getting involved in Planned Parenthood is just one way to remain vigilant so that we make sure that Illinois remains a safe haven state for everyone when it comes to abortion access and care. And of course, I love my Black community, and working in the Black community and doing this work is an honor and privilege. So thank you so much for having me and allowing me to talk a little bit about my work today.
Well, I want to reciprocate and say it's an honor and privilege to be with you here today, and we are grateful for your work, for the work of your organization. Be sure to check out the website, the app, all of those resources that we mentioned throughout the episode. Thank you so much, Mariana, for being here. And a shout out to the whole Planned Parenthood Illinois team and action team. We appreciate all that you do to support reproductive health in Illinois. I also want to thank CAN TV's nonprofit team for helping us produce today's Community Pulse. My name is Megan Phillip. Thank you so much for watching Community Pulse, which airs on CAN TV Channel 21 and is also available streaming at cantv.org. Stay well, Chicago. We'll see you next time.